We've got 470 people in the audience who are now all experts in everything that you do.
Not quite. They need to come on a course.
Well, I'm not asking this question to advertise the course, but personally I would want to do one rather than just watch you having done what you've done there. What do you cover on the course?
We start off looking at the what it means to be dizzy. So we talk about setting the dizziness within a sort of psychosocial context, because that's important, as we touched on early on, talking about the disability, because we need to be aware of how it affects people. We look at the physiology behind it, because the physiology, although rather challenging, it's important because the better we understand the physiology, the better I can interpret what I'm seeing. And if I'm interpreting correctly, I'm much more likely to be effective with my intervention. So a basic understanding of the physiology is good. We go through the practical exam, just basically looking at eyes and the gaze stability tests and the different central versus peripheral differentiation tests. We look at BPPV, posterior canal and lateral canal. We don't really do the anterior canal on the first course. And we look at vestibular rehabilitation planning, and that's planning the rehab based on what we see in the patient. So not on a recipe or a list of exercises or a guideline, because they're good starting points, but we can be a whole lot more effective if we base it exactly on the patient. Okay.
And at the end of the day's course, you'd expect people to go away confident enough to be able to say to their GP, got dizzy patients, I reckon I could give them a go.
Yeah, to start off with, yes. I think the key thing I would say would be that you need to be able to recognise the serious pathologies. If you're going to be dealing with a neurological symptom, you've got to be able to recognise when it's a red
Absolutely,
flag.
yeah.
So that's the most important thing to take away. Secondly, yes, a basic vestibular assessment, which with a bit of practice takes only a few minutes, and you can incorporate it into your normal musculo-skeletal exam that you already do. And then a knowledge of treating at least the posterior canal comfortably, and then basic exercise programming. And obviously the complex patients will challenge you if you've got very limited experience. And we don't talk about the more complex conditions and the central conditions. Right. I do a follow-up course if people want to go there.
Let's get the basic one out of the way first of all.
For sure.
Yeah, I mean, from what you've said, there's a large population of potential patients out there who are not getting ready access to treatment, who could benefit from this, which is...
It's a huge number, and it's a crying shame, because this group of patients, more than any other group I work with, are the ones who get better. So these are the ones which are really satisfying, and the ones where you feel you're actually making a difference, and you really do make a difference. That's the thing.